Good evening. My name is John Wyan. I'm a proud member of the St. James Mercy Hospital Board of Directors. On behalf of the fellow board members, the leadership team, medical staff, the employees of St. James Mercy Hospital, I'd like to welcome you to our third town meeting regarding the transformation to sustainable health care in our community. Our goal tonight is to share how we're accomplishing this mission of transformation. We are a year into this process. Not many people thought we could make it. Some thought we would no longer have healthcare presence in this community. Now we're on a very positive path forward, thanks to the hard work of everyone who supports St. James Mercy. The list includes each of you that are here tonight. Without your support, whether it be through the use of our services, the donation of time or money, or simply moral support, we wouldn't be here tonight. When I last stood before you in May, we just announced our plan to work with UR Medicine to transform to the new vision. Since that meeting, President and CEO Jen Sullivan has been working around the clock to preserve quality health care in this community. Tonight, Jen will provide more insights into that effort, answer many of the frequently asked questions. Jen's been a wonderful leader for St. James Mercy, and we're pleased that she accepted the role of President and CEO during this time of transformation. Before I introduce Jen, I would just like to give a special thank you to our Mayor Sean Hogan and to Mayor John Felci for all their support they've given to this whole process. Now, at this point, ladies and gentlemen, please welcome Jennifer Sullivan.
Hello. Can everybody hear me okay? Sometimes I'm supposed to put it closer. So, as we start on the first slide, let me make sure I start doing this the right way. We'll start with our town hall meeting objectives. As you can see, one is to share the progress we've made since our last meeting in May. To answer frequently asked questions, we've been getting a lot of questions from the community. What we thought might be helpful here is to go through some of them with you before our Q&A session and see if maybe some of these will answer your questions. And then to provide some insight into next steps. So where were we? I think we started at the bottom of the hill, and we've actually shown this path in many of the town hall meetings, where the challenges we were facing here in Hornell are challenges you're seeing across the country. And so it seemed like we had a really big upward path to climb. And at each meeting we've been to, this is our third town hall meeting, we show movement, positive movement up that path. We're still not at the top, but certainly making our way there. The reason I show this slide at every town hall meeting is I think it's always helpful to remember where we started and why are we looking to transform, what is going on, and why are we here at this position. And really, the hospital struggled for quite a long time. It's not unlike other rural healthcare providers across the country. Basically, increased competitive pressures, lower utilization across the country, inpatient and use of inpatient hospital facilities has declined. And what that means is where a lot of your revenue is generated, or was historically, has now gone away. And as people are better, they're not as sick, there's more preventative care, better drugs, more done on an outpatient basis, you've seen, and hospitals have seen their revenue decline. And then it makes it harder and harder to make ends meet. So then you're trying to compete with others to survive. The state and federal government have their own deficits to deal with, and in that they've cut rates over time. And so when you look at all this together and the economy, you can see how it makes a set of numbers that's just very, very difficult to deal with. And that's why you've seen the healthcare crisis across the country. So we're not alone, doesn't make us feel any better, but we're trying to figure out how to make that better. St. James Mercy Hospital, at its peak, had 119 beds working, and that's actually how many inpatient beds we're licensed for. Right now, just to give you a sense, our average daily inpatient census is 7. So if you look at an average day at St. James, we'll have about 5 medical surgical patients in the hospital, maybe 2 maternity. Now granted, when you're in a rural area, you'll see that go up and down. Some days will be a little higher, some days will be lower or no one inpatient, but that's what it averages out to be. So just by that number alone, you can see most of what we do, and again, is on an outpatient basis. People not getting sick enough to be input into the hospital, better drugs, what have you, but people are going home. So where were we in May last time we met? Well, we had just announced that, well, actually a little before that, we announced the work of the New Vision Task Force had come together. We had developed a business plan for a sustainable healthcare presence in Hornell going forward. We had announced the selection of UR Medicine as the larger organization, they're actually Rochester-based, that we were looking to work with on a going forward basis on the plan for healthcare in Hornell. Our goal continues to be to ensure this community has access to healthcare services going forward. Since the last town hall meeting, I guess we're now June, July, and halfway into August, so 60, 90 days ago, the time goes by very fast. We've been working on a variety of things with the New Vision, but there's really been a right-hand turn, and I'll show you or explain a little bit more about what that means. Because it seemed as though our New Vision for Healthcare in Hornell, which really is a robust, great vision. It's outpatient focused. I think we've talked about that a little bit in prior town hall meetings. But it was generated in the context of this community, Hornell, and where it typically draws its patient base from. And that's a logical way to develop a business plan, right? I mean, who do you take care of now and where do your patients come from? Look at the zip codes, where do they come from? That's how we developed this. What the state was doing, and we were going along on a very rapid path. As you may recall, the New Vision Task Force did their work in January, February, and March. We met every single Friday, weekly, and really gave it our all to get that plan together, fast, comprehensive, all the pieces put together. And we took that plan to some larger organizations, knowing we needed a larger organization to work with us to make the finances and the operations work going forward, to attract someone to Hornell to work with us. And our plan was good. We did get some proposals, and we did select UR Medicine to work with. So now we all go excited, and we go to Albany. We have this wonderful plan. We now have someone who's looking to work with us, a larger partner. And this is in the April time frame, and the state basically said to us, stop, you're moving way too fast. We understand you need to transform the delivery system, and you're totally on the right path. We like what you're doing, and it does appear that what you're proposing will be sustainable in the long term. So a larger solution. But geez, as a state, we're rolling out an initiative, and you're moving a little too fast, because our initiative is a statewide initiative. It focuses on regional collaboration, and it works on reforming the Medicaid system across the whole state. So if you go ahead and implement your transformation in Hornell, and you don't wait until we issue this new program from the state, you may not be in sync. And so we want you to stop, sustain your operations as is, slow down, and revisit your New Vision for Healthcare in Hornell in the greater context of a bigger region in the state. And so we're like, okay, and we had all this momentum, and of course we were concerned because our cash flow was depleted in March. We knew we needed cash, and they said, we understand you need to transform quick because you're out of cash. However, we'll give you funding, we'll help you sustain your operations, we'll cover your shortfall in cash so you can sustain what you're doing and work in a larger context of the region to refine your vision. And so really that's what we've been doing. And so that's good news and bad news at the same time. I think the good news is we have cash coming in to support our operations. I think the challenging news is it delays the movement that we're all waiting for, which is more clarity to know what's going to be in this community and what's the healthcare going to look like here going forward. And I know it's frustrating. It's frustrating for us as well, but it is what it is, and that's really where we're at this point in time. So if I look at quality, I think it's important to know that our team of physicians, nurses, and staff, continue to earn recognition for high quality of care. And I mean, in the middle of this significant amount of change and transformation, you can see or understand how it would be hard for staff to keep their heads up, their chins up, and stay positive, give good quality care, and they're doing that. They're coming to work and giving it their all. And if you look, there's just a whole host of quality recognitions we received this year, and I thought it was very important to recognize that the staff is doing a yeoman's job, even in the midst of significant change. So over the summer, we did, again, you may have seen it in the newspaper, we did secure funding from the state, $6.4 million, to sustain our operations, our cash shortfalls, while we work on planning and redoing our vision in a bigger, grander context. And we are continuing to work with the University of Rochester and other healthcare providers in the region on this larger state initiative I was talking about. What has evolved, and you know, it's hard to know how far back to back up, but when we started working with the University of Rochester, it was in the April timeframe, the university was, and other healthcare providers across the state were trying to figure out what is the state initiative and what does it mean to us. So we were really working with just them at that point in time. And then this initiative, it's called DSRIP, and I don't want to get into this hoary-gory boring detail, but that means Delivery System Reform. And that's what the state is working on. And basically, as part of this initiative, at the same time that was rolling out, up in Rochester, there was a big change in players up there. Not necessarily a change in players, but who was working with who. And on July 1st, so it was a little more than a month ago, Rochester General Hospital and Unity Health System merged. And they created a large health system in Rochester, and they call it the Rochester Regional Health System. So now there's two large players in Rochester, the university that we're working with and RRHS. They decided that it was in their best interest for this state initiative to work together. So these two large players are now co-leading this project, of which we are a part of. It covers a 14-county region. So when I'm talking about, you know, looking at our new vision for healthcare in Hornell, we now need to look outside of the walls of Hornell and expand it into not only the region, the neighboring region, you know, whether it's Dubuque County, Allegheny County, Livingston County, but all the way up to Monroe County. They created a PPS, a new system under this program that covers 14 counties. So we are part of an initiative that includes 14 counties. And what the state said is they're basically recognizing the transformation in Hornell. They totally get it, they understand, they've been supportive. They also know we need money to build a new building, because to provide the services we need in this community, we cannot continue to operate out of the 411 Canisteo Street building. It's aging, and it'll cost $2 million more per year to operate out of that building than it would out of a new building. If you're trying to achieve financial sustainability, you got to get that extra cost out of the system. So they get it. They know we need a building. But they said, you know, we're not going to give you money to build a building if your plan is only for Hornell. You got to think about what we're trying to do as a state. We're trying to address healthcare across the region and the state. So when you update your new vision for healthcare in Hornell to fold in these other pieces, then resubmit your capital request for your building, and then we'll look at that. So I hope that helps you understand how we got from something that was pretty well packaged and ready to move on to a state initiative being rolled out and us being asked to stop, to where we are today, trying to figure out, well, where do we fit in the greater context of the bigger region? How do we work with our other healthcare providers that are our neighbors? How do we all work together to make something that's going to work financially, and we all don't go out of business or suffer or compete to the destruction of the healthcare system, especially in rural America? I believe there was just an announcement of a rural hospital closing up in Lockport. I think their last day is Friday. And that's the first one in New York State this year, as I understand it. It's the 10th rural hospital closure this year alone. So just if it gives you some context, it's really a big issue. If you look on the left where the yellow is, that was the work of the New Vision Task Force. And that's what probably many of you had your arms around. That was January through April. And we got the business plan done, we attracted a partner, and we were ready to start working with them in April. So then you see the University of Rochester in the middle of the blue, and they're squeezed in between us finishing what we were ready to move on, and then the state initiative to the right, which is in green. And the New York State transformation effort, again, this is what I explained, where the state told us, slow down, stop, you're moving too fast. So the university's kind of caught in between wanting to work with us and trying to help the state reform. And so, and to be honest with you, UR Medicine has collaborating institutions in our surrounding areas. And if you think about it, the interest is to make sure we can all succeed and we can all continue providing rural health care to our communities, and not at the expense of one another. And the state's made that very loud and clear. One is not going to succeed by putting another one out. You all need a core set of businesses. Figure it out is basically the message. So where are we today? Again, we're still not at the top of the hill, but we're certainly moving our way up the hill. And then I'll move into some frequently asked questions, see if this might be some of the questions you have. So what does regional collaboration mean to me? That might be something you're thinking about. Well, the state is transforming the safety net system. What does that mean? If you have a large amount of Medicaid, uninsured, or dual eligibles, meaning they're on Medicaid, Medicare, you know you're part of, or the revenue we generate is from the state and federal government. They're trying to figure out how to balance budget deficits, right? So you got to transform that and take the cost out of the system. That's really the goal here. The way they're going to do that is to reduce avoidable hospital use. So what they're saying basically is you're doing too much work inpatient. It's extremely incredibly expensive. And you're doing too much in the emergency room. If you guys could figure this out, people wouldn't get sick enough to have to be in a hospital, or they wouldn't stay as long, or you could treat them on an outpatient basis. And also, people are using the emergency room because there isn't adequate access to primary care. So really, that's the thought. You know, keeping an inpatient facility staffed and running is extremely expensive. That's why the state's trying to encourage the improvement on the outpatient side. And they want this to be sustainable. I think there's, you know, you're seeing hospitals go out of business and they're saying, this is not working. People, they're getting sick, they need to be taken care of. We can't just see one hospital after another close. Something's wrong. This picture is really just to kind of give you a visual. Not interested in showing you all the numbers, but see the different colors. Remember how I told you the two big systems in Rochester are working together on a 14-county region? We're part of that green region, you see. We're called the Finger Lakes PPS, but you can see the state is, there's clumps of counties now working together under this new state initiative, and these clumps of counties are working together to figure out how they're going to address healthcare in that region. And so when I talk about the larger region, that's what that means. So there's a bunch of them across the state. This is evolving. I could show you this slide today, probably another one tomorrow, and another one the following week. It's an iterative process. It's not like that's the picture and we go with it. It just keeps evolving. This is a larger map of our 14-county region, and that's where I can show you that if you look in the blue line, that's the 14-county region. But you can see we're in there with providers all the way up from the lake down to the southern tier. And so, you know, how will we all work together to make this work? But the intent is the acknowledgement that we need to, we know we need to, and we need to move our healthcare systems to financial viability and sustainability in the long term. So what are the next steps? Well, we need to define what does regional collaboration mean? And that, again, is happening under the leadership of UR Medicine and the Rochester Regional Health System, the two large players that are leading the initiative in our 14-county region. Can we move forward without it? You know, can we just say, we don't really, we just want to deal with the issue we have here. We don't want to, we need to do one thing at a time. Well, basically, as I mentioned earlier, New York State has made it perfectly clear to us that if we want to move forward with our transformation, it's going to happen through the regional collaboration. It's not going to happen at the expense of one of the neighboring facilities or not be in the best interest of the state reform. And so it's not that they haven't been supportive, because they've been extremely supportive and helpful. They understand our situation, but they don't want to fix one problem and create another. And we have to understand where they're coming from there. So I know one big question everybody's having is, when are we going to know what services are going to be in this community? We know what we got now. We know what we want. We identified what this community needs most of the time. But how do we know what we're really going to have? And I anticipate that we'll know that by the end of the year, because as part of this larger project, state project I was telling you about, the application for it's due in December. So in my mind, if you're going to apply to do something that reforms Medicaid, you're going to have some level of clarity by the end of the year. Could that change? It could. But you know, this is a huge effort across 14 counties. It's going to take some time to work that all out. So then you might be asking, well, what's going to happen in April when the cash runs out? We know you secured $6.4 million to operate through the end of March. Then what? Well, one of two things is going to happen. We're either going to go live with the new vision for healthcare in Hornell, or we're going to have to continue sustaining operations as is with additional state funding. I can't imagine any scenario where the state would support us financially for a transformation to the tune of $6.4 million and then say, oh, if you need a couple more months, we're not going to help you. That just wouldn't make any logical sense to me. So I guess what I'm thinking is we either can get this together by April 1st in the greater context of the larger region, or we'll have to sustain operations a little longer and hang in there a little longer. Is the building still included? Absolutely. Again, you know, to spend an extra $2 million a year to operate out of what we have and to keep patching and repairing an aging facility does not make sense. What the building looks like exactly, what services it will host, will definitely be an outcome of the regional collaboration. So just wanted to be clear, I know many of you probably saw the article in the paper in June that we applied to the state for $26 million to build our facility. That was an effective month for us. We did a lot of advocacy. We sent the request up. There was a lot of dialogue. It created a lot of momentum, a lot of visibility for us, and Hornell is on the radar screen. That being said, there was a pool of money which could have been used for that building at that point in time. But subsequently, the state decided we're going to take this pool of money and tie it to that district project, that bigger regional project. So they said, you're going to have to resubmit your project in the greater context of the region. We still need a building, okay, but we need to revise it in accordance with the larger project. So don't want you to think that went anywhere. We just got another dead end that the dead end was stop, hold on, you're still moving too fast, rework it in the greater context of the region. Similar to what we heard on the other. So what happened to the New Vision Task Force? Some of you may or may not recall that task force was convened to complete a task. And their task was to develop a financially sustainable and viable business plan for healthcare in this community. And they did that. They met every Friday. They completed their task. That being said, there is a need for the New Vision Task Force as needed going forward, and we did ask them to stand ready to reconvene when we need them. We just couldn't continue to draw on their time week after week without having a new task. And the new task with the region, in the greater context of the region, that process is developing and evolving as we speak. So I want you to understand there's New Vision members out there, but they're no longer meeting on a weekly basis. And we do thank them for their work. We appreciate their standing in to reconvene. We do have dialogue with many of them, but it's not an active task force right now, just so you're clear on that. What is happening with the sale of the nursing home? Well, basically, we are seeking a buyer. When we were looking at the transformation of healthcare in Hornell, we know this community needs a skilled nursing facility. The service is needed, it's used. And we felt that as you're trying to transform a system as large as ours, which includes not only primary care, but acute care, behavioral health, and long-term care, we wanted to make sure somebody was taking care of the long-term care transformation, focused on that. And we felt it would be best served by an organization that specializes only in long-term care. Our goal, again, is to make sure this community has the services it needs, the attention each product line or service line needs, and that the operator provides good care to the community going forward. Our ventilator unit closed because it wasn't being utilized, and you can't afford to keep that type of a unit open when there's very little use of it. So what can we provide or receive? What types of care can we receive at St. James today? We today are continuing to sustain our operations and provide the full array of services that we have for quite some time: primary care, acute care, chronic care, long-term care, and behavioral health. So we have, a list. It's not a comprehensive list, but, obviously emergency, lab, and imaging. Our outpatient surgery, our outpatient procedures include surgeries, scopes, infusion, dialysis. We have physical therapy, occupational and speech therapy, orthopedics. Primary care, we have many providers in the community: internal medicine, family medicine, pediatrics, OBGYN. I could list them all, but we'd be here for a long time. We still have and provide inpatient and outpatient addiction services, inpatient medical, surgical, and maternity, long-term residential care, adult day health care, and short-term rehab. So you can see that when you're looking at that much stuff, you need to break it out into categories where you can attack each one and address it really well. Can I deliver my baby at St. James is a question we're hearing a lot, and the answer is yes, you can. And we do have providers at St. James that can do that. And they can continue to receive care in our Pullman Women's Health and Birthing Center. So just wanted to make sure you're clear on that. We have Drs. Sen, Yang, and Peterson all do maternity. Drs. Yang and Sen also do GYN work. Will Dr. Rupert deliver at St. James Mercy Hospital is another question. And he'll basically continue serving patients in this community because his office will remain where it is in Hornell. Beginning on September 2nd, he'll be delivering babies at Jones. So hopefully that provides some clarification. We've sent letters out to patients and tried to do communications. Hopefully the word is out, but in case you're not clear on that, that's what's happening September 2nd. Is maternity part of the new vision? And the answer is yes. Our vision does include the continued provision of OBGYN care. And so I just want to thank you all for coming and open the floor up for questions. We're clearly moving to the top of that hill, and as you can see, meeting after meeting, we're making our way up one step at a time.
Question.
My name's Sean Hogan, Mayor of the City of Hornell, member of the New Vision Task Force. During our deliberations with the New Vision, Jen, one of the assurances we had from our parent organization at the time, which was Catholic Health East, that they were going to cover any debt the hospital had and cover any legacy costs. Is that still part of the program?
Yes, one of the keys to sustainability and to make the equation work going forward was how would we handle the $17 million of legacy corporation debt, and the answer is yes. CHE Trinity is now the name. On July 1st, CHE merged with Trinity Health System, so we're now fortunate to be part of a system that actually now covers half of the United States. It's both positive and a challenge at the same time. But that being said, having that parent, actually they did infuse capital and cash into the organization so we could operate in March, April, May, and June before the state funding began. And they will also cover the legacy debt, which is now estimated to be about $17 million in the aggregate. Thank you. And you can imagine how hard it is to attract a partner or anybody to help you reform a system if you come with that much baggage.
Do you work with the individual hospitals in this area, like Jones and Dansville and other hospitals in the area, on an individual basis, or is this something there is a big conglomerate that everybody gets together and somebody else decides who gets what?
It's a little bit of both, but when you get to the who decides what, the data is going to drive that. So what the state is doing, they're completing a community needs assessment, and the data will drive it. So who is utilizing what services where will really dictate what will be where. But yeah, we work with the other hospitals and one-on-one if we have something we need to work on together, or in larger context of DISRIP, we're all at the same meetings talking about, well, how is this thing for the larger region going to work? And we're all still trying to figure it out. It's kind of it's very complex is the best way I could put it. So.
What about the opening of the urgent care facility? Is that being better utilized, and is it taking some of the stuff away from the ER that was inappropriate before?
Yes and yes. The ER volumes have gone down as a result. On a combined basis, if you add the two together, our volume has increased. So clearly there was a community need for express care. It's being used, and it's a success story.
What is your plan for St. James Hospital at 411 Canasteel Street? Is it going to be a pile of bricks, or is it going to, what will happen? Are there any special plans for that?
Not as of yet. What you do is I'm trying to think, what do you call that plan where you look at facility reuse plan? We did complete a facility reuse plan, so if that happened, what are the options for that facility? And there are some, although that really will be phase 2. Right now we're focused on preserving healthcare in the community, and then we'll pull out that facility reuse study and figure out how else could we use that facility or that area there. So I really don't have a good answer for you yet, but it is definitely on the checklist as part of the bigger picture. Laura, there.
I was just wondering, I talked to you once before about having new doctors coming to our city, and you told me that you're working on it, but what's happening is they're all leaving.
Yeah, I think, you could answer that two ways. When you're in times of significant change, uncertainty, I think there is a tendency for people to get nervous and wonder, where's the best place for me going forward? I think the key is to keep them in the community, serving the community. So many of the changes we've seen, such as the group on Loader Street, McKellar's group, Dr. McKellar's group, they're still in the community providing care here. We did bring in the orthopedic group, and they're providing orthopedic services 5 days a week. We opened the express care, and we have providers there. We redeployed providers to Alfred. So it may not appear that we're bringing in a lot of physicians, but really the fact that we've been able to sustain our operations and actually staff what we have has been a pretty incredible feat given the lack of clarity at this point in time and change and uncertainty. So, I don't feel like we have tons of physicians leaving per se. I mean, I think it's going to be a challenge that's not only now, but it's probably going to continue until we have that clarity everybody's looking for. Dr. Rupert's going to be delivering babies at Jones, but he's still going to have an office practice here taking care of patients in the community. So I think it's all how we look at it, and I think we just need to say, are we still getting the services that we need, and focus on that first, and then I think you'll see the improvement of the services and the addition of new providers as the new vision unfolds in conjunction with a provider and the regional collaboration. So I hope that helps a little bit, but it's a tough deck to be dealt. Yes.
Jen, are you planning on doing any laser surgeries?
Dr. Carroll? I asked the clinicians to help me with these things.
At this point, we have no specific plans for doing anything beyond what we already do. So it would require recruiting somebody who has that special set of skills. And my guess is that the size of the community probably wouldn't support somebody with that specialized skill.
Thank you.
I'd like to answer the question that was just asked about future physician manpower in the community. A few weeks ago, I had lunch with Dr. Randy Johnson, who is head of University of Rochester's primary care physician network. He is a practicing internist. He has office at Strong as head of their primary care network, and he also has an office in Barrington where I had lunch with him. And University of Rochester's concept of primary care in this region is evolving. In the past, historically, it has been limited to the greater Rochester area, Barrington, Spencerport, the surrounding towns. And I think it was a good exchange of information for both of us. They're now beginning to look this far out. I said, what might be your time course? Of course, all this is tangled up with the state of New York and district and all this stuff. But their time course is probably 12 months. They actively recruit and place about 12 primary care physicians. And the face of primary care is changing. I said, I'm getting along the beard here. And he said, well, don't expect you're probably going to be replaced by an internist. I said, what's happening to all of them? He said, they've got $300,000 in debt by the time they get out of med school and residency. They started a family, and they're not going into primary care. They're using the internal medicine residencies to go on into specialty work. The future is probably going to be basically family practice. And they're going to try to help us out in the context of the next 12 months. They have to go to the university's board of trustees because this is a new mission for them. And the other thing that was exciting when we met with our U of R representatives, we may be able eventually, as things come together, and all this is speculative, we may be able to attract residencies at the University of Rochester in family practice primarily. So I think there's a lot of good. It's down the pipeline at least 12 months or longer, probably longer. We have to be patient right now. We're a little bit frustrated on the New Vision Task Force. We hit the ground running, came up with a great plan, and the good old state of New York said stop. So everybody please be patient. You got some higher
There's an awful lot of negativity out there, and you'll say, oh, I wouldn't go to St. James because they don't have good care and this and that. Is there anything that can be done to improve that so that, it's hard to tell everybody how great it was, and it was. My daughter was just in the ER. It couldn't have been any better. Everybody was just great. So I don't know where it's coming from, but we ought to do something if we can.
Yeah, no, I agree with you. The rumors have been very difficult, and it's been a pretty large communication campaign to try to offset that. We have a great story with quality. We try to share some here. I know Dr. Carol or Kathy or Sylvia could probably share some words with you along their thoughts along those lines. But I think you talked about that at management team yesterday as well. And I think the best ambassadors we have are within our four walls of the hospital. So what we're trying to do, because really the employees are the community, and we have a lot of them, and to ensure that they feel that they have the message they need to carry out is important. So we have been holding employee forums. We try to send them communications on a regular basis and doing the best we can, but we're always open for more ideas because it's a real challenge to figure out, what are we not doing right that we can't overcome that. We did recently open a social media presence. We have Facebook. I know Sylvia could tell us more about that, thinking maybe that will help with some of the communication piece. But we're certainly trying, and any ideas you have, please bring them to Sylvia's attention. And if we need to give you cards to help you understand what you could say, we'll do whatever you think you need us to do to help you help us. Thank you.
Well, I worked there for 30-some years. I ought to know something about it.
I agree. Yeah, please.
Just to add to that, thank you. And I know you and I enjoyed the tour together of the hospital, so it's good to see you. Yes, that's wonderful. But just to add to Jen's comments, we are actually creating a patient advisory council. And so I offer that tonight to any one of you so that, again, we're reaching out more to the community. We've changed a lot in the last 6 months. We're changing more. The outcomes are definitely changing. But we also, the more that we hear from the community that we serve, we welcome your feedback. So anyone tonight, you can grab me after the meeting. I would love to take your name and number. And so we are creating that council. And hopefully some of you have received some phone calls. We're also doing some follow-up phone calls to the patients from our staff, and we're incorporating that feedback each and every day to improve the services. So believe me, we're changing things every day. And we have much more work to do, we know, but we're very proud of the improvements. Our actual patient satisfaction scores improved 20 points over the last quarter. So that proves that we are making a difference. But if any of you would like to continue on to help us on that journey, I would love to take your name and number, and we'll involve you in any way we can on the advisory council.
The news from I heard now that the cancer center is closing. Did you confirm that? Or?
The Cancer Center is not part of St. James, although their building is, on the same campus. And so, I don't believe I've seen an announcement on that. Has there been an announcement public on that? But there is something going on with the Cancer Center. I'm not sure what the bigger plan is going forward, and I know it's an evolving next step as well. So I have no detail on that. I apologize.
Well, the doctor,
Do you?
he passed away suddenly, Dr. Wally.
Dr. Dollywall passed away. Yeah.
He passed away, so it's in a state of flux.
Yeah. Is Lou here? Chance? No. Okay.
Any other questions?
Jen, I know the new building hasn't been green-lighted yet, and I know it's going to be data-driven what it looks like, but do you have an idea of the size and scope that you'd like to see?
Yeah, it's pretty much the work of the New Vision Task Force. That's that $26 million building is what we would like to see. But reality sets in that, we may not have everything we want, but, that's what we believe the community needs most of the time was where we started. But that may need to be scaled back or modified as appropriate in the greater context of the region. So that work, again, you're right, will be data-driven. Hopefully we'll know by the end of the year. But that's what we were looking for, that $26 million scoped outpatient facility. Outpatient-focused facility, I guess is the better way to put it. Any other questions? Well, thank you very much for coming. I appreciate your support. I really, really do. And we'll keep you up to date. And not sure when the next meeting is. If we're in August, it'll probably be October, November time frame. Thank you.